Hi, Dr. Hans here from Optimal Wellness, and today I want to talk about pinched nerves. And if you've ever had neck pain or low back pain before, you've probably heard of the term. But what a pinched nerve is if we have a misalignment in the bones in our back, then that can cause irritation or pressure on these nerves. And pinched nerves are more common as we age because as we have these misalignments in our spine, it'll cause the spine to break down, which can cause degeneration. So when we look at a nerve, there's three parts to a nerve. We have the sensory part, which is responsible for pain. We have the motor part, which is responsible for moving our muscles. And then we have the autonomic nerves, and those are responsible for the organs, the glands, and even the blood vessels within our body. So when we have a pinched nerve, and you can see the pain part of it is actually the smallest part. But most of our patients that come in generally come in because of the pain aspect. But most of the time when we dig a little deeper, we find that they have a lot of these other symptoms going on as well. So the first thing most people experience is pain when they have a pinched nerve. And that can be locally, it can be in one spot, but it can also travel wherever that nerve goes to. So in your neck, these are the nerves that are going to go down into the shoulders, arms, hands, and fingers. In your middle part of your back, these are the nerves that are going to go wrap around to the front of the chest, wrap around those ribs. And then the lower back, these are the nerves that are going to go down the legs, which is referred to as sciatic pain. Now, pain is not the only symptoms you can experience. You can also experience muscle weakness. So where those nerves go to, once again, if they're going down your arms, you can have weakness down at the arms. Your grip strength can be decreased, or you can have weakness going down into the legs. It can also cause muscle spasms and even tightness. So your body tries to brace that area by causing tightness or muscle spasms within that area to protect it, but that can be very uncomfortable. And then the autonomic part, these are the ones that are going to the organs within your body. So if you have low back pain or a pinched nerve in the lower back, then that can cause digestive issues. If you have a pinched nerve there in your neck, in the upper part of your neck, that can even cause sinus or allergy issues there as well. So what do we do to correct this? So in our office, the first thing that we do is a chiropractic adjustment. So I'm going to show you how we do that. So I've got my patient here. We're going to adjust her lower back. That's the most common place to have a pinched nerve. And when someone has a pinched nerve, a lot of times it can be very sore or very tender. So we like to use very low force adjustments to start with. So I'm going to use a drop table. It's a specialized table here that allows us to perform that adjustment with very, very low force. So let's go ahead and get her adjusted. Okay, very good. So that is the adjustment. The second thing we do for pinched nerves in our office is we have a massage therapist on staff, and she is going to work on those tight muscles or those spasms that are trigger points that are occurring in the muscles. Because if we have a lot of tension or tightness in those muscles, then it can pull the spine back out of alignment and cause more irritation to those nerves. And then the third thing we do in our office for pinched nerves is use something called spinal decompression. And so we're going to go down the hall here and I'll show you how we do that. Alright, so the third thing we do for a pinched nerve is something called spinal decompression. So this table right here is the spinal decompression therapy. So what it's going to do at that strap that goes around your waist is gently going to stretch the back, and this table is going to slowly come apart. And what that's going to do is it's going to create an aerobic exercise for those discs in your lower back. And so if we take a look at what a disc looks like, this is a healthy disc here, and then this is a dehydrated or this is an unhealthy disc. And so when those discs become degenerative, they'll also develop things called disc bulges or disc herniations. And as that disc bulge pushes back up against the nerve, then that's going to cause those symptoms we talked about earlier. So the spinal decompression helps to relieve that pressure on the nerve, helps to pull that disc back in the center of where it should be, so it's not compressing or pinching that nerve. So I hope this helps, and I hope you guys, if you have any comments, comment below or share this or like this so other people can see it as well. And you can always reach out to us at 425-1911 or visit our website at mywitch.chiro.com. Well, that is it for today. We will look forward to seeing you guys next week.